We're back on MD-VOD, where today we're talking about stroke, and we're joined by neurosurgeon and stroke expert Dr. Jeffrey Thomas. And now we're taking your questions live from Facebook and Twitter. First question is, Dr. Thomas, when someone presents with, let's say, an ischemic stroke, and we talked about that a little bit earlier, the difference between ischemic and hemorrhagic. Let's say they have an ischemic stroke. It's they have loss of the right side of their body. What are some of the therapies available?
Well, that part of stroke is a medical emergency, and the most important thing to do is to restore blood flow to the part of the brain that's suffering and that's causing that neurological deficit. So there are two branches of treatment. One is medical and the other is surgery. We usually try medical first, and in 1996 there was a drug that was FDA approved for stroke. It dissolves blood clots, which are often the cause of stroke, and that drug is TPA, tissue plasminogen activator. We will administer this drug to a patient with a new stroke if the stroke has occurred within the last 4.5 hours. It used to be 3 hours, but the studies have shown that it's actually safe enough within 4.5 hours. So once we determine that you have not had the hemorrhagic or bleeding type of stroke, then we consider it safe enough to give this drug.
So TPA, it's a very fancy blood clot dissolver. It has other names as well, but it's a time-dependent thing, so that's very important. Make sure if you have symptoms, a loss of hand control, losing the ability to speak, for example, your foot one-sided, as Dr. Thomas points out, get to the hospital as soon as possible. You may be a candidate for this new medication. When is surgery indicated? Let's say a carotid endarterectomy, where they remove the plaque in the artery or put a stent in. Yes. What is that indicated?
Well, the type of surgeries that we have for stroke now have increased substantially from, say, 10 years ago. And the reason for that is the branch of medicine that is known as interventional neuroradiology, which is a way to operate on the brain from a remote location, usually from a tiny incision in the leg. So through the incision, an incision that is the size of an eyelash, a tiny catheter can be passed all the way from the leg, through the chest, through the neck, into the head, into the brain, and delivered to the segment of artery that's blocked. Once we get there, and this is exactly what you do in the heart, except we go further, and once we get to the area of blockage in the brain, we can deliver more of this drug, except now we deliver it directly to the site of occlusion, or we can use a surgical device to pull blood clot or debris out of the artery. And these devices are brand new. We're talking about FDA approval for some of these devices that just happened not more than 2 months ago. Wow. So now we have technology that allows us, these catheters and micro guide wires are phenomenal. This is not only digital imaging technology, but it's also micro machining and hydrophilic materials so that you can slip through the bloodstream undetected by the body. These are phenomenal new technologies available to create brain surgery for stroke.
Wow, that's amazing. Very similar to cardiology, but what's impressive about what you do is, you know, mine's easy because I have a wire that goes from your leg to your heart, which is a pretty short distance. You're going all the way up into the circle of Willis, and
it gets curvy up there.
It does get curvy up there, and so it's a lot easier than he's making it sound. You know, other than the TPA, the guide wires and stents and things, is there any new therapy in interventional neuroradiology that you can use for, let's say, aneurysms or even tumors in the brain that can cause strokes?
All of the above. In fact, these microcatheters and microguide wires will deliver you to whatever pathology exists in the brain. Now, aneurysms are like a balloon on a blood vessel, and the problem with those is they burst, usually without warning, and they put you in immediate danger of death. So the goal of aneurysm surgery is to prevent that bleeding from ever occurring again. With the tiny catheters, we can now guide things like platinum microcoils right into the aneurysm sac and deliver the microcoils in such a way that we just fill it with platinum, and it can no longer fill with blood. That's one of the more modern aneurysm treatments. Of course, we still have the old-fashioned 1937 aneurysm clipping with a titanium microclip that's opening the skull and getting right in there using an operating microscope. And so we still use that for 50% of the cases.
It's impressive stuff. You know, all of this technology, these hydrophilic guide wires and the aneurysm treatment that you're talking about with the coils, it's incredible technology. It's got to be expensive. What about insurance? Does insurance typically cover the costs of some of these new technologies?
Yes, and the reason that insurance will pretty unequivocally cover such costs is that these are life-threatening emergencies. Every case of a stroke or a ruptured cerebral aneurysm, that immediately puts you in danger of death, and the insurance companies would have a very hard time denying that kind of payment.
One of the things I wanted to mention about Dr. Thomas is, you know, he's a neurosurgeon. Literally spends his life saving lives of people that are flown in by helicopter, literally, and he is a neurosurgeon. You know, what's also really impressive, I have to say, personally, about you is that you spend a lot of your time talking about and teaching the community about prevention. Preventing strokes from ever occurring with kids and the San Francisco Stroke Shield Foundation. Can you tell us a little bit about that program?
Yeah, just as you say, we have tremendous technology these days and it does wonderful things, but stroke and cerebrovascular disease are the perfect illustration of where an ounce of prevention is worth many pounds of cure. So what these diseases are all about is prevention, similar to your own specialty of cardiology. So, with that in mind, the Stroke Shield Foundation, which is strokeshieldfoundation.org on the web, it's an organization that is whose purpose is to implement improved treatment and prevention of stroke. If you think about what we already know about stroke, the fact that we have identified these risk factors, the risk factors are very strong, and every single risk factor is modifiable. That means we have control, the patient has control. So it's the job of the doctors and of organizations like Stroke Shield Foundation to make it so that people pay attention to these risk factors. You know what's out there, and heaven forbid you should ever know what a stroke is really like, because it's a life changer, it's a life ender, and if we can prevent it, we should do everything in our power, and prevention is a lot simpler than treatment.
And in the long run saves, you know, I would imagine a lot of money in terms of healthcare dollars.
Absolutely.
That's a great point. I want to thank Dr. Jeffrey Thomas, the Director of Interventional Neuroradiology at Washington Hospital in Fremont, California. He taught us about the diagnosis, the treatment, and prevention of stroke. This was a great program. I want to thank you very much. If you missed anything on today's show, please go to emPOWERme.tv, MD-VOD for stroke. Thank you so much. We'll see you next time. Thanks, everyone. And now, for any episodes you might have missed, they're available at the emPOWERme.tv website and the YouTube channel. And be sure to leave us any comments and questions so that we can better help you deal with your disease. We'll see you next time on MD-VOD.